So it's a nice and bright sunny day. I am Dr. Vishal and welcome to another video. So today we are going to learn basic suturing technique. So now this technique is useful for anybody who wishes to know how to suture human tissue, and it is useful for interns or healthcare workers if you live in a remote place where you don't have anybody who can teach you all these things. So perhaps this video will be able to help you learn the skill, and then you can practice and master it. So this book which you see is one of my favorite books. I read it many years back, R.M. Kirk 6th edition, and a lot of what surgeons have learned, a lot of what I have learned about suturing comes from this book. And there are a lot of other things in this book. If you have the time, you can perhaps download or buy one of these and go through it. So for learning suturing today, we will practice it on this silicone suturing model, or it is basically a silicone model of skin, and it is also in various layers, just like how human skin is in various layers. You can buy it off Amazon. It comes for around 2,900 rupees without the instrument. They come in 2 slabs of silicone, and you can use both for suturing. One has all the incisions made earlier and the other one comes plain. So we will start practicing on this. If you have to learn suturing at home, you are not at the hospital, not a medical student, then you will require some other instruments also, and I am laying them out over here. And that is, you must have suturing material. I am using Ethlon, which is basically nylon, and it is 1 number. Some other day we will sit and discuss what various sutures mean and which one is used when, absorbable, non-absorbable, so on and so forth. And then you will require a needle holder, you will require some sort of scissor, and you will require a forceps. Under emergency situations, you can do without one of these or more of these, but ideally speaking, when you are learning, it is good to have instruments in hand. Now all of these instruments come in various sizes and shape. You can have needle holders of various kinds, big, small, with different types of locks, different types of tips, and different types of bows. You can also have various kinds of scissors. For example, this is not the most correct scissor to have for cutting suture. This is more of a tissue dissection scissor and tissue cutting scissor. You don't use this for cutting suture because they become blunt, and for tissue dissection you need a very sharp pair of scissors. But for cutting sutures, it is okay to have a little blunt. So generally you don't mix the two. But if you are practicing in a developing country like India, there will be very high chances that you will not get the correct pair of scissors or the correct pair of instruments that you want or are your favorite, and you will have to do with what you get. Again, this is a pair of forceps. Forceps, like I said, come in various types. This is a tooth forceps, and you have another forceps which is fine, which is called Adson forceps, and they are basically instruments to assist you in your ability to close the tissue or close the sutures or close the wound. And you can have or choose the instrument which you like depending on what exactly are you doing. If you are a general surgeon or a plastic surgeon, an orthopedic surgeon, or some other kind of surgery that you are doing. So having said that, the basic principles of suturing remain the same, and very quickly we'll get into how do you start suturing, and we will see step by step that how can you take a basic suture and try to approximate 2 edges of the skin. So first things first, we should know how to hold the instrument. This is the bow of the instrument, this is the joint of the instrument, and like you can see, the instrument is held like this. Your index finger should be free so that you can navigate the instrument in a proper manner. You should have your thumb and your ring finger inside the bow. Again, this finger is free. It is meant to give support to the instrument, and the little finger is free to sometimes give support to the hand by resting it on the tissue itself. So that is how you hold the needle holder. Similar principles go for holding the scissor. When we use the scissor, we will see what is a better way of cutting sutures precisely, and then comes the forceps. When you are suturing, it is always preferable to have a tooth forceps of some kind because it is easier to pull the needle out with the help of a tooth forceps. And then of course there is suture. So we will use this incision today. This incision is very similar to the kind of incisions which you will more often make on the body when you are operating on it. A very clean, straight cut incision. And so we will start by opening the suture. This is how the suture looks, and this is the needle where it is already attached. There might be a situation where you will get a needle separate and a tissue and a thread separate. You might have to thread it, but these things happen only in very remote places these days. Otherwise, most of the places a prefixed suture is available. Now if you look at the needle, it is very important for you to know where to hold the needle with the needle holder, and where you hold it with will pretty much determine how quick and how neat you are with your suturing technique. So generally the dictum is that you mentally divide it into 3 parts and you have to hold it 1/3 towards the eye and 2/3 towards the tip. So somewhere off the center but more towards the eye of the needle, right? So this is how you would hold it. Again, like I told you, the fingers will stay here, and eventually this is the position that you will be start your suturing in. So the next thing that you have to do is that you have to make sure that this thread is not coming in your way. Now there are different suture materials. This one is Ethelon. It does not has much memory. So if once you pull it back, it will not come in your way. Something like Proline has much memory, so you have to straighten it out before you start suturing. The next thing I want you to know is that when you are suturing, the first step is to make sure that the tip of the suture is perpendicular to the skin and is around a centimeter away from the edge. This is what the book says. However, in reality, it depends on what area you have, what is the consistency of the tissue, what is available, what area is available for you to start suturing. So in all ideal circumstances, you should be somewhere around 1 centimeter away from the edge, and the needle should be perpendicular to the surface of the skin. What new people do is that they don't really understand, or they don't know the importance of this step, and they end up trying to enter the skin at an angle. And what happens is that they don't enter it fully. They are in the epidermis, and then they cut through, and if at all the suture goes through, it is a very poor quality suture which does not hold the tissues together and does not serve the purpose. So the first thing that you would want to do is make sure that the needle is perpendicular to the skin. And another advantage of doing this is that if you do it like that, your wrist goes into a rotation, and after that the struggle is very less for you to drive the needle through the tissue. All you have to do is straighten your wrist, and the needle will automatically come out from the other edge without much effort on your part. So once you have done this, you have to push it across. Some experienced surgeons might want to take the second bite right after the first bite, and if the tissues are close by, you might be tempted to do so, and it is completely fine if you can manage to pull it off. However, as somebody who is learning it, the proper step to learn is that you have to pull this out completely and then take your next bite. One thing I've learned out of experience is that you should not hold the needle very close to the tip, because the tip is delicate, and there might be a chance that if you hold it at the tip might get curved or become hooked, and then practically the needle becomes useless. You have to throw it away and use a new one, and you might get scolding for wasting a length of suture. Having done that, you can pull this out. Now here comes the use of a forceps. I am using one hand to pull this out. However, in a real life scenario, you will have your forceps in the other hand, and you will hold it in between your forceps to pull it out. And then you might hold it, and then you might pull it out completely. This is something that a lot of new surgeons do. Another way of doing it is that if you don't have a forceps, or you don't wish to use a forceps, you should always hold the needle somewhere near the eye and make sure that the tip is not pointing towards you, and you are protected from unwanted injuries. Many a times in emergency situations, you don't know the serological status of the patient. You might injure yourself with unwanted pricks on this hand. This hand happens very often. It's an occupational hazard. But a very good way to minimize it is that you hold it over here at the eye, and then you try to wrap the suture around you, making sure that you are under any case not coming near the tip of the suture. So once you have done that, you can pull it gently so, and a few centimeter of tail over here is good to have. Then you will have to remove this, detangle it completely, and then you are ready to take the second bite. Again, the principles remain the same. Wherever you touch the skin, it has to be perpendicular to that surface, and then you can drive it very easily. Again, approximately 1 centimeter distance is a good distance to have. You pull it out, hold it with your hand if you don't wish to use a forceps. Here, everything is very hypothetical. This is the consistency of the tissue is very good. It is not moving at all. There is no blood. There is no additional obstacles which you will encounter when you are suturing it in real life. Hence, you probably don't need a forceps. However, in real life, sometimes without a forceps, it is not possible to take a suture. So here we have driven the suture. What we have just seen is a simple suture. There can be another suture called mattress suture, in which the whole exercise is repeated the other way and then the knot will come here. However, today we will only restrict ourselves to learning the simple suture, which if nothing, you can use it in all possible situations, and then you can build upon your skill by learning more complicated methods of suturing. Now is time to take the knot. Generally, when you're taking the knot, you take 2 throws for the first knot. So this is 1 throw, 1 full circle is called 1 throw, and then there is another throw. This is the second one, and then you hold the tip of the suture with the needle holder. Now, something that a lot of new surgeons or anybody who's learning it for the first time do is that they hold it over here or anywhere else. The trouble is that if you don't hold it at the tip and you try to slide the knot, then it will not come properly and this tail will come in the middle. So the quality of the knot is not so good. Hence, you should avoid doing that, and instead what you should do is that first throw, second throw, and hold it as much as possible at the tip. Now this is because it is nylon, it is a very firm structure. If you are using something like absorbable Vicryl, then there is a chance that it might be flimsy and it is not always possible to hold it right at the tip, but that is fine. The next thing we need to know is that we have to square the knot. 2 throws have been taken and then you square the knot. You cross your hand, square the knot, and then you tighten it slowly, gradually and gently, and make sure that both the edges of the tissue are approximated. It should not be too tight. Something that a lot of new surgeons learn by experience is that how tight are your sutures will not decide how early the wound heals, and will also not decide whether the wound is closed or will the edges will approximate in a better way. The tightness of your suture has nothing to do with that. The job of the suture is only to approximate the edges of the skin, and that is pretty much where their job ends. What decides wound healing is the various factors which are there which bring about wound healing, and suture pretty much does nothing to change the effect of those factors. Now I have taken the second throw. The second throw is also taken like this. Here you don't have to do it twice. It is enough to do it once. The job of the second knot is to keep the first knot in place, and it is not really necessary to change your hand, the side of your hands, or to square the knot in this case. However, what needs to be kept in mind is that the first knot was finished like this. The second knot must be finished perpendicular to it so that it can apply sufficient pressure on the knot underneath, and it prevents it from opening up. Then the third knot, which is perpendicular to the second knot, if you're in a real hurry, which you shouldn't be, then 3 should be enough. Otherwise, ideally, 4th and 5th knot is taken in a non-absorbable suture material like nylon or Ethlon. Right? So this is how the knot is taken. So now it is time to cut the suture. The rookie way of cutting is that somebody would cut it like this, and then it would be your scissor would be shaking here and there, might touch other tissues which you don't want. The good way of cutting it is to support it with something, 1 finger, 2 finger or 3 finger depending on how much distance you have, and then have your assistant pull the thread and then cut it over here like that. A good length if you are using a removable suture is to have 1 or somewhere around more than 1 centimeter, so that it is easy to pull it while you are removing it and put your scissor underneath and cut and remove the suture. The next thing that you need to know while suturing is that how far the second suture be, and this is a common question or something that a lot of interns and a lot of new people are confused about. By the book, if you go, there is a dictum which says that the suture should be 1 centimeter away from the edges and generally 1 centimeter away from each other, and that is the dictum that I have followed and it has served me well, and so I pretty much stick to it all the time. And then start the exercise all over again. So drive it in, take it out, again drive it in, take it out, hold it, wrap it around your fingers, 1 loop, 2 loop, or 1 throw, 2 throw as they say. Tie it properly. Another one. Tie it again. Third. Fourth. And fifth. Ideally speaking, this is the assistant job, and then you can cut it and we are done. I hope you learned something. Let me know how the video was. Let me know if there's anything else you would like to ask, if there is any way in which I can improve, and I will see you in the next video.